Recent studies highlight the importance of decent housing as a prerequisite for good health. In this report from South Yorkshire, Jonathan Gibson speaks to one of the NHS Alliance's new leaders, Merron Simpson, who firmly believes that good housing can be just what the doctor ordered.
Merron Simpson trained as a biochemist, but it was through voluntary work helping the homeless that her career found a new direction.
Housing is fundamental, isn't it? It's a basic human requirement. Without a roof over your head, without somewhere where you feel safe, where you feel good, then we all would struggle to live healthy and good lives. And it did start making me think differently about homelessness, about housing, about how our systems and our services work, and why it is that some people seem to fall through the cracks. And I guess part of why I moved into housing is a desire to see services and systems work for the most vulnerable in society.
Merron believes that when housing organisations and health services work better together, they can deliver more appropriate and cost-effective care. That's why I've come to South Yorkshire to see how this can work in practice.
They're lovely and very popular. Filled them immediately.
Tony Stacey runs the South Yorkshire Housing Association and is building new relationships as well as new homes.
Very often what health commissioners, for example, are looking for is organisations who can open up access to the kinds of people, very often our tenants, who aren't necessarily on all of their registers. For example, in Doncaster, where we're standing at the moment, we've got a very successful social prescribing scheme where the GP will sit there with a social prescription pad next to them. Maybe that person's been in 5 times that week, and really what that person needs is some help sorting out debt, or perhaps the person's lonely. Whatever it is, they can write a social prescription and we will take it from them and get that issue sorted out. And we know that that leads to the patient going back to their GP much less.
What we're really saying is that housing organisations can make your life easier, especially because they're a key community partner and they can be a link with other community partners.
Michelle works for Doncaster's CVS, another community partner which delivers social prescribing. Hi Michelle.
Hi, nice to meet you.
And you. Why have you brought me here?
So that I can show you the flats that one of our customers previously lived in before moving into supported living accommodation. This gentleman was 75 years old with chronic obstructive pulmonary disease. He lived here alone, experiencing a high degree of isolation. This is where he's living now. He's not on his own anymore. He's now able to socialise with all the other residents, and there's also staff available 24 hours a day.
So by changing his housing, you've really transformed his life?
He's much brighter in himself and feels a lot better, definitely.
The challenge is sometimes to enable GPs and CCGs to think about letting go of some of what they're trying to do, which is actually quite difficult because GPs feel responsible for their patients. The ask, I think, from housing is that the health sector enters into a dialogue with them.
The Housing for Health website was developed by Merron to do just that, sharing information with health professionals so they can work more effectively with housing organisations.
Really, it's just to provide a window on housing for the health sector. It's written in straightforward language and small amounts. GPs and CCG's time is very precious.
The organisations involved in this initiative in South Yorkshire are modest about their achievements, but by working more effectively together, they are producing results.